Immunity, an Ounce of Prevention, one of the flagship service projects of the Mu Sigma Phi sorority, has been conducting annual forums dedicated to relevant and pressing health matters in the country. Today, in celebration of the World Immunization Week with the theme Long Life for All, the Mu Sigma Phi Medical Sorority Incorporated from the UP College of Medicine, in partnership with the Mu Sigma Phi Foundation, Philippine Foundation for Vaccination, Philippine General Hospital, University of the Philippines Health Service, and the Mu Sigma Phi Fraternity present to you Immunization, a Passport to Longevity. This webinar is free and open to all. We are now using UP Manila live stream, FB Live at MSPS Immunity, and YouTube Live at tinyurl.com/muheals. If you're encountering problems in internet connectivity, kindly refresh the page. For UP Manila live stream, kindly turn up the volume using the audio icon. For other problems, please refer to the downloadable guide at the bottom of the live stream window. The webinar lectures will run for 15 to 20 minutes each. There will be a total of 3 lectures. Afterwards, a question and answer portion will follow. Ask questions or comments by typing in the Zoom and UP Manila live stream Q&A box on the right lower corner of your screen, or type in the comments box in the Facebook and YouTube Live. This event is brought to you by Immunity, an Ounce of Prevention of the Mu Sigma Phi Medical Sorority Incorporated, under the Mu Heal campaign and the Mu Sigma Phi Foundation, in partnership with the Philippine Foundation for Vaccination, Philippine General Hospital, UP-PGH Health Service, Association of Philippine Medical Colleges Student Network, and the Mu Sigma Phi Fraternity. For today's webinar, there will be 3 lectures, followed by a Q&A portion at the end of them all. Please feel free to send in your questions through Zoom, Facebook, YouTube, and UPM livestream anytime during the webinar. This webinar and our previous webinars are uploaded on our Facebook and YouTube sites listed here. Please follow Immunitweets on Twitter for more updates. You may also follow us on our social media accounts: TikTok @MuHeals, Instagram @MuHeals, Facebook MuHeals, and YouTube MuHeals. We have also installed this set of immunity booster stickers available for free on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. Please see the download links for Viber and Telegram in the video description. Additionally, we have launched this new set of stickers, Immunity Boosters 2.0, also available for free on Viber and Telegram. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features an immunization record and tracker, an information atlas on all vaccines available in the Philippines, and frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Just search Immunity Mu Sigma Phi Medical Sorority Incorporated and click Install.
Fact or myth? Nakakamatay ang bakuna. Magandang araw po, ako si isang estudyanteng doktor at nandito ako para sagutin ang tanong na ito. Nakakamatay ang bakuna. Ito po ay isang myth. Ang mga bakuna ay inilikha para maprotektahan tayo sa iba't ibang uri ng sakit gaya ng trangkaso, bulutong, COVID-19 at marami pang iba. Sa pamamagitan ng pagbabakuna, nakakaiwas tayo sa labis na pagkakasakit at binabawasan din ito ang panganib na maging talamak ang sakit sa isang komunidad. Muli po, ang bakuna ay hindi nakakamatay. Ito ay nagsisilbing shield o extra layer ng proteksyon ng ating katawan laban sa iba't ibang uri ng sakit. Para sa karagdagang kaalaman ukol sa pagbabakuna, link in our bio! At laging tandaan na ang bakuna ang pangunahin at pinaka-epektibong prevensyon sa iba't ibang uri ng sakit. Balik tiwala, balik bakuna!
Fact or myth? Mapapalitan ng iyong DNA kapag ikaw ay nagpabakuna. Magandang araw po, ako si Jessa, isang estudyanteng doktor, at nandito ako para sagutin ang tanong na ito. Mapapalitan ng iyong DNA kapag ikaw ay nagpabakuna. Ito po ay isang myth. Ang katotohanan, ang bakuna ay naglalaman ng DNA, RNA o protein material na siyang nagtuturo sa ating katawan kung paano labanan ng sakit. Ngunit, hindi nito binabago o pinapalitan ang ating genes. Hindi makakaapekto ang bakuna sa ating genetic material at mas lalong hindi nito papalitan ng ating DNA. Ang bakuna ay ligtas at mabisa. Ito po ay maling usap-usapan lamang at hindi batay sa katotohanan. Para sa karagdagang kaalaman tungkol sa pagpapabakuna, link in our bio, at laging tatandaan na ang bakuna ang pangunahin at pinaka-epektibong prevensyon laban sa iba't ibang uri ng sakit. Balik tiwala, balik bakuna!
Welcome to today's webinar. For years now, Immunity an Ounce of Prevention, one of the flagship service projects of the Mu Sigma Phi Sorority, has been conducting annual forums dedicated to relevant and pressing health matters in the country. Today, in celebration of the World Immunization Week with the theme Long Life for All, the Mu Sigma Phi Medical Sorority Incorporated from the UP College of Medicine in partnership with the Mu Sigma Phi Foundation, Philippine Foundation for Vaccination, Philippine General Hospital, University of the Philippines Health Service, and the Mu Sigma Phi Fraternity present We are now using UP Manila live stream, SB Live at MSPS Immunity, and YouTube Live at tinyurl.com/muheals. If you're encountering problems in internet connectivity, kindly refresh the page. For UP Manila live stream, kindly turn up the volume using the audio icon. For other problems, please refer to the downloadable guide at the bottom of the live stream window. The webinar lectures will run for 15 to 20 minutes each. There will be a total of 3 lectures. Afterwards, a question and answer portion will follow. Ask questions or comments by typing in the Zoom and UP Manila live stream Q&A box on the right lower corner of your screen, or type in the comments box in the Facebook and YouTube Live. This event is brought to you by Immunity an Ounce of Prevention of the Mu Sigma Phi Medical Sorority Incorporated, under the Mu Heal campaign and the Mu Sigma Phi Foundation, in partnership with the Philippine Foundation for Vaccination, Philippine General Hospital, UP-PGH Health Service, Association of Philippine Medical Colleges Student Network, and the Mu Sigma Phi Fraternity. For today's webinar, there will be 3 lectures, followed by a Q&A portion at the end of them all. Please feel free to send in your questions through Zoom, Facebook, YouTube, and UPM livestream anytime during the webinar. This webinar and our previous webinars are uploaded on our Facebook and YouTube sites listed here. Please follow Immunitweets on Twitter for more updates. You may also follow us on our social media accounts: TikTok @MuHeals, Instagram @MuHeals, Facebook MuHeals, and YouTube MuHeals. We have also installed this set of immunity booster stickers available for free on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. Please see the download links for Viber and Telegram in the video description. Additionally, we have launched this new set of stickers, Immunity Boosters 2.0, also available for free on Viber and Telegram. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features an immunization record and tracker, an information atlas on all vaccines available in the Philippines, and frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Just search Immunity Mu Sigma Phi Medical Sorority Incorporated and click Install.
Fact or myth? Ang bakuna ay may kasamang microchip. Magandang araw po, ako po si Faye, isang estudyanteng doktor at nandito po ako para sagutin ang tanong na ito. Ang bakuna ay may kasamang microchip. Ito ay myth. Ang ating bakuna ay hindi naglalaman ng microchip o tracking device. Walang anumang uri ng aparatong pagsubaybay sa ating mga bakuna. Ang karayom na ginagamit sa pagbabakuna ay higit na mas maliit kumpara sa pinakamaliit na microchip kaya nakakasigurado na hindi ito basta't-basta maipapasok sa ating katawan. Ang listahan ng mga sangkap sa bawat bakuna ay matatagpuan online. Ang bakuna ay ligtas at mabisa. Ito po ay maling usap-usapan lamang at hindi nakabatay sa katotohanan. Para sa karagdagang kaalaman ukol sa pagbabakuna, link in our bio! At laging tandaan, ang bakuna ang pangunahin at pinaka-epektibong probensyon laban sa iba't ibang uri ng sakit. Balik tiwala, balik bakuna!
Fact or myth? Hindi na ako magkakasakit pag ako ay nagbabakuna. Magandang araw po, ako si 𝐏𝐚𝐬𝐬, isang estudyanteng doktor at nandito ako para sagutin ang tanong na ito. Hindi na ako magkakasakit pag ako ay nagbabakuna. Ito ay myth. Maaari pa ring mahawa ng sakit, ngunit hindi ibig sabihin na hindi mabisa ang mga bakuna. Sa makatwid, ang bakuna ay laban sa mga malubhang karamdaman o pagkamatay. Halimbawa, kapag ikaw ay nagpabakuna para sa COVID-19, magiging ligtas ka laban sa mga malubhang sakit dulot ng COVID-19, pangangailangang maospital, at pagkamatay dahil sa COVID-19. Lahat ng ito ay maaaring maiwasan. Dahil sa bakuna, ikaw ay protektado. Para sa karagdagang kaalaman ukol sa pagbabakuna, link in our bio. At laging tatandaan, ang bakuna ang pangunahin at pinaka-epektibong prevensyon laban sa iba't ibang uri ng sakit. Balik tiwala, balik bakuna!
Oratio Imperata para sa proteksyon laban sa COVID-19 virus. Mahabagin at mapagmahal na Ama, nagsusumamo kami sa iyo upang hilingin ang iyong patnubay laban sa COVID-19 na nagpapahirap sa marami at kumitil na ng mga buhay. Tunghayan mo kami ng may pagmamahal at ipagadya kami ng inyong mapaghilom na kamay mula sa takot sa kamatayan at karamdaman. Itaguyod mo kami sa pag-asa at patatagin sa pananampalataya. Gabayan mo ang mga dalubhasang naatasan na tumuklas ng mga lunas at paraan upang ihinto ang paglaganap nito. Nagpapasalamat kami sa mga bakunang naisulong sa patnubay ng iyong mga kamay. Pagpalain mo ang aming mga pagsisikap na mawakasan ng mga bakuna ang pandemya sa aming bayan. Patnubayan mo ang mga lumilingap sa may sakit upang ang kanilang pagkalinga ay malaki pa ng husay at malasakit. Pagkalooban mo sila ng kalusugan sa isip at katawan, katatagan sa kanilang paninindigang maglingkod at ipagsanggalang sa karamdaman. Itinataas namin ang mga nagdurusa. Makamtan nawa nila ang mabuting kalusugan. Lingapin mo rin ang mga kumakalinga sa kanila. Pagkamitin mo ng kapayapaang walang hanggan ang mga pumanaw na. Pagkalooban mo kami ng biyaya na magtulong-tulong tungo sa ikabubuti ng lahat. Pukawin sa amin ang pagmamalasakit sa mga nangangailangan. Sa pagdamay at malasakit namin sa bawat isa, malampasan nawa namin ang krisis na ito at lumago sa kabanalan at pagbabalik loob sa iyo. Hinihiling namin ito sa pamamagitan ni Hesukristo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, Diyos magpasawalang hanggan. Amen. Tumudulog kami sa iyong patnubay, mahal na Ina ng Diyos. Pakinggan mo ang aming mga kahilingan sa aming pangangailangan at ipag-adya mo kami sa lahat ng kasamaan, maluwalhati at pinagbalang Birhen. Amen. Mahal na Birhen, mapagpagaling sa may sakit, ipanalangin mo kami. San Jose, ipanalangin mo kami. San Rafael Arcangel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
For today's forum, we have an alumna from the University of the Philippines College of Medicine class of 1989. She has a subspecialty in infectious diseases from the Department of Obstetrics and Gynecology of the Philippine General Hospital and is the current Vice Chancellor for Academic Affairs at the University of the Philippines Open University. She is also a consultant at San Pablo College's Medical Center and an associate professor at the University of the Philippines Open University. Let us all welcome Dr. Maria Rowena Del Rosario-Raymundo.
Hello everyone, I'm Dr. Wen Raymundo from the new Sigma Phi Sorority, batch 1989, and that's the 5 p.m. Signal in San Pablo City where I'm streaming from. And I'm speaking on behalf of the immunity team of the Mu Sigma Phi Sorority. It's 5 in the afternoon in Manila right now, and we're streaming live from our homes and offices in light of the current situation. By the way, I'm no longer the VCAA. I am currently on leave for doctoral studies. Now, we join the world in celebrating World Immunization Week by presenting this webinar entitled Immunity, a Passport to Longevity. Immunity is in line with the theme, Long Life for All. And through this educational experience, we'd like to stress the importance of vaccination and its role in bringing people together and improving the health and well-being of everyone. This event is brought to you by Immunity, an ounce of prevention of the Mu Sigma Phi Medical Sorority Incorporated, under the Mu Heal campaign and the Mu Sigma Phi Foundation, in partnership with the Philippine Foundation for Vaccination the Philippine General Hospital, the UP-PGH Health Service, and the Mu Sigma Phi Fraternity. For today's webinar, there will be 3 talks, followed by a Q&A portion after all our speakers have spoken. Please feel free to send in your questions through Zoom, Facebook, YouTube, and UP live stream anytime during the webinar. So let's go to our first talk. Our first talk for today is entitled Immunization Through the Years. And we are privileged and honored to have our first speaker, Dr. Melvin Sanicas, who will walk us through the development of vaccines over the years, especially in the Philippine context. Dr. Sanicas is a public health physician scientist who specializes in infectious diseases and global health. He was recently awarded as one of the 10 outstanding young men of 2021 for science and medicine. Congratulations. He took up BS Biology in UP Manila and is also an alumnus of the UP College of Medicine. He obtained a master's degree in infectious diseases from the London School of Hygiene and Tropical Medicine and achieved another master's degree in science in vaccinology and clinical development, where he graduated cum laude in the Università di Siena in Italy. He earned his doctoral degree in microbiology and immunology in the University of Zaragoza in Spain. And on top of all these, Dr. Sanicas also finished his MBA at the University of Leicester in the United Kingdom. Currently, he is the Senior Medical Director at Clover Biopharma and is an active member of various professional and civic organizations. Please join me in welcoming Dr. Melvin Sanicas, Mu Sigma Phi Fraternity, Batch 2006. Dr. Sanicas?
Thank you very much, Doc Wen, for that kind introduction. So I will be sharing my screen now. Please tell me if you can see my slides. So I hope
we can see it clearly.
Okay, great. So good afternoon, everyone. First of all, thank you to the Mu Sigma Phi sorority and the organizers of immunization for inviting me to be part of this webinar. It's certainly an honor to talk about immunization during the World Immunization Week and to be in the same panel as Doc Wen, Professor Lulu, and Doc Beverly. Today, I am going to talk about immunization through the years. It's always a challenge to talk about this topic because it started hundreds of years ago and I only have 15 minutes or so, but I will try to make this short talk as high yield as possible. First of all, some disclosures. I'm employed by a biotech company called Clover Biopharma, and I work as a technical consultant or an advisor for several groups and companies listed here, but I am not representing any of them today. And I am here in my personal capacity as a physician and a scientist who's been working in the field of vaccines, viruses, and global health for over a decade now, way before vaccines became as popular as they are now. So I want to start with a reminder that after clean drinking water, vaccination is the most effective public health intervention. We can't cover everything in the history of vaccines here, but we will look at some of the highlights. So the practice of immunization really dates back hundreds of years. Several accounts from the 1500s describe smallpox inoculation as practiced in China. And inoculation may also have been practiced by scratching matter from a smallpox sore into the skin. And they call it variolation as well. It is difficult to really pinpoint when the practice began, as some sources claim dates as early as 200 BC. But it's safe to say that this practice is really, really old. And when the Chinese Emperor Fulin died of smallpox, his son became the emperor. And having already survived a case of smallpox before he became the emperor, he was a supporter of inoculation. And on the right, you will see here, this is Lady Mary Montague. She had her son variolated in Constantinople, which is now in Turkey. And her husband, the ambassador to Turkey then, had been disfigured by smallpox, and she had heard about variolation upon her arrival in Turkey. So she asked local physicians to give the variolation to her children, her son especially. This is Edward Jenner. He is considered the founder of vaccinology in the West. He had heard of stories that farmers were somehow immune to smallpox, and that even if they got smallpox, they did not die from smallpox. So what he did was he inoculated a 13-year-old boy with pus taken from the skin of a woman infected with cowpox. And he demonstrated that you can have immunity to smallpox using this technique. Of course, during that time, there was no GXP. When I say GXP, this is like good manufacturing practices, good laboratory practices, or good clinical practices. If you do this now, if you get pus from someone and infect someone with it, you will definitely go to jail. But during that time, it was okay. In Western languages, the word vaccine actually came from the word vacca, which in Latin means cow. I just wanted to show this cartoon because I want to emphasize that the anti-vax movement is basically as old as vaccination itself. During the time, they were saying that tiny heads of cows will grow on people who receive the vaccine. Of course, it sounds ridiculous, but some people believed it then. It's like the ridiculous anti-vax tropes you hear now, like those who got the COVID vaccine will become zombies or will become magnetic and so on and so forth. Going back to smallpox, it's actually the only human infectious disease that's been eradicated. But before it was eradicated, it is estimated to have killed up to 300 million people in the 20th century and around 500 million people in the last 100 years of its existence. So that's around 5 million every year. So to have a better appreciation of that number, keep in mind that COVID killed over 6 million people in 2.5 years, but smallpox was able to kill 5 million every year for the last 100 years of its existence. Now, this is Louis Pasteur. His experiments spearheaded the development of the live attenuated cholera vaccine and inactivated anthrax vaccine in humans. And the first plague vaccine was developed by a bacteriologist in 1897, and his name is Valdemar Haffkine. So after developments in science and techniques used in science, bacterial vaccine development started. And it started really with the Bcg vaccine, or the Bacillus 𝐾𝐬𝐬𝐿 vaccine, and it's still being used today. It has existed for over 100 years now, and it's one of the most widely used vaccines in the world. And here you will see the countries in the world still using Bcg, including the Philippines. Then viral tissue culture methods developed from the 1950s up to the 1980s. And this led to the development of the Salk inactivated polio vaccine and the Sabin live attenuated oral polio vaccine. Polio has existed as long as human society, but it became a major public health issue in the late Victorian era with major epidemics. And mass polio immunization has now eradicated the disease from many regions in the world. In the next few slides, you will see some infectious diseases and how their epidemiology changed with introduction of vaccines. So the first one, here you will see the deaths caused by smallpox in London. As you can see, before the vaccine became available, smallpox infected 1 in 13 Londoners, and 1 in 13 died of smallpox. And you will see that when the vaccine became available, cases started to decrease significantly until UK was able to eradicate smallpox, and the world was able to eradicate smallpox in 1980. The next disease that you will see here is polio. This is in the US. So before the vaccine became available, you will see the cases increased increased from the 1900s to before the vaccine became available. But you will also notice that even though the cases are going up, the number of deaths were not going up as much. So the deaths you will see in the purple line there. But when the vaccine became available, because of the discovery of Jonas Salk for the inactivated polio vaccine and Sabin for the oral polio vaccine, you will see the significant decrease of polio cases in the United States. And then you will see here cases of measles in the US. So before vaccines became available, cases were recorded up to 800,000 each year. And there was even a time when this was even higher than that. But you will see on the right, when the vaccine became available, cases also started to decrease significantly. But you will see that this is just until 2015. But if you continue this, cases of measles started going up again. And this is because of several communities in the US. The parents of children in several communities in the US started to avoid getting the vaccine because of the anti-vax movement. So here you will see the different pathogens when they were discovered and when vaccines or the vaccine became available for that specific pathogen. I created this early on in the pandemic, and my goal really was to give people an idea of the speed of development of the different vaccines for different pathogens, considering the different scientific era these germs were discovered and the different technology available during those times. And the key word here is different. We are also in a different situation now. And the world was able to develop COVID-19 vaccine so quickly because of years of previous research, because of enormous funding from governments and private institutions, and because regulators also move quickly than normal. And here, if you look at the different pathogens, you will notice that, for example, for covered in 1983, we still don't have a vaccine, and it's been almost 4 decades. You will also notice that for SARS-CoV-1, which was identified in 2002, we don't have a vaccine, but the virus disappeared, so it's fine. And for SARS-CoV-2, the coronavirus that causes COVID-19, it was first identified in 2019, and we already had the vaccine in 2020, and this was just 10.5 months. So in the next slide, you will see here the different advances in science that led to the fast development of COVID vaccines. So all these advances in science happened over the past years and without much attention. So early on in the pandemic, people would say that, for example, the mRNA technology is new. Well, for most of us not working on mRNA, it is new, but for people who have been working on mRNA since the 1960s, of course, this is not new. So you will see here that advances in reverse vaccinology, in structural vaccinology, and synthetic biology all helped scientists and researchers develop different vaccines for different pathogens, like the meningitis B vaccine, which was developed in 2012. And then you have here other pathogens as well, like the MERS-CoV vaccine, which is still being developed. And hopefully we will have this MERS-CoV vaccine in this year or next year. So I would like to just end my talk with this slide, because I think COVID vaccines really are some of the most incredible medical and scientific advances in history. And the level of importance of COVID vaccines is not appreciated by many people. So for me, it's actually as important as the moon landing, as important as the discovery of penicillin. And the reality is these COVID vaccines will be the solution, and will be the way for us to end this current pandemic. And hopefully you will all be more active in promoting vaccines in your circles, not just in social media, but in real life as well. So with that, I end my talk, and I will be happy to answer questions. Thank you very much for your attention.
Thank you very much, Dr. Salitas, for that very interesting historical perspective on vaccination and how it relates to our current time. Sabi nga nila, di ba, sometimes in order to keep moving forward, not only must you take it one step at a time, but you must also be willing to look back occasionally and evaluate your past, no matter how painful it is. Because if you see those statistics on smallpox, di ba, the smallpox deaths, because looking back lets you know whether or not you are headed in the right direction. Hindi ako nagsabi niyan. Yan ay direct quote from G.K. Adams. Diba? Pero very, 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 very interesting and very, very informative. So salamat, Doc Melvin. So for our viewers, if you have any questions, you may send them by commenting in Zoom, Facebook, YouTube, or through UP live stream. So now we move on to our next talk. Our next talk for today is entitled Why Vaccination Matters. And our speaker is a Professor Emeritus in the UP College of Medicine. She is the founding president and current executive director of the Philippine Foundation for Vaccination. She is the former vice chancellor for research and executive director of the National Institutes of Health, University of the Philippines, Manila, and the current head of the Vaccine Study Group of the NIH UPM. She is the president of the Immunization Partners in Asia Pacific, or IPAC, current executive director and past president of the International Society of Tropical Pediatrics, the past chair and founder of the Asian Strategic Alliance for Pneumococcal Disease Prevention, or ASAP, and executive director, secretary general, and past president of the Asian Society for Pediatric Infectious Diseases. Our speakers are so accomplished. All our speakers are so accomplished. And our second speaker is truly accomplished, but on top of all of these achievements, what she is most proud of is that she is a grandmama to 6 beautiful grandchildren, ages 3 to 17, all of course with complete childhood vaccinations. And except for the 3-year-old grandchild, all completely vaccinated against COVID. So she and her family really walk the talk. Here to speak on the importance of vaccines and relevance of herd immunization is none other than Dr. Lulu Bravo. Dr. Bravo?
Thank you very much, Wen. So good afternoon to all of you there, to the panelists, to the attendees, and most of all to the Facebook viewers. I'm trying to get on our Facebook because this is what I usually do when I'm on webinar. If there is a Facebook, you can ask your questions there too, and I can also be monitoring them. So at this point, if I can now share my screen, let me see. I'm going to talk about why vaccination matters. And ladies and gentlemen, indeed, vaccination matters. Let me see. Why is it not going up? There you go. All right, guys. This is my disclosure. I have been a vaccine trialist for almost 35 years and a vaccinologist. I've been giving vaccines for the last 45 years, being a pediatrician of 45 years. And mind you, vaccine trials and vaccine advocacy would be the best thing that has happened to me in the last so many decades of my life. Because we all know from what Dr. Melvin said, through the years, 230 years of vaccinology, and we have the most powerful vaccines that we can get in the 230 years. 30 diseases, more than 30 actually, are now vaccine preventable. Whereas before, in the Middle Ages, people live only up to 40, longer if you are 45. But right now, people live up to 100. There are many people now who can be given 100,000 just because they reached the wonderful age of 100. And mind you, aside from clean and water, actually, vaccine should be credited for 95% of global health today. That's the first thing I learned in my vaccinology course. And as we said, if you do not yet know this, please, for every dollar that is invested in vaccine by public health people, they can regain benefits economically and medically, $44. Can you beat that? Vaccines are an investment in health. And true enough, we have saved millions and millions of lives just because vaccination and vaccines are available. Vaccines will not be anything unless it is administered. And that's the reason why it is vaccination that must be carefully weighed into our system. Because even now with the COVID, there are many vaccines that might in fact expire. We need to give them to the most vulnerable, the elderly, the people who really need it most. And we do need to also wait until the official recommendations are given. Now, ladies and gentlemen, why is it that despite all the qualities that Dr. Melvin has mentioned and all the things that have been done in the last 230 years, people are still afraid of vaccine? Well, because there are always people who are so skeptical, or sometimes they call it cynical, and they come out with so many controversies. They want to do some form of devil's advocate, if you may say it that way, and they come out with noises. Of course, we cannot say that they should be silent. Of course not. This is a world that is okay with freedom of speech. But then your rights to try and scare people should also be balanced with a good and supportive expert and official recommendations. They said in the early video, I heard the new student said, okay, there's an ongoing news that vaccines can kill. Excuse me. It is not vaccines that kill. It is misinformation and disinformation that kills. Just like in 2019, when people got scared of vaccines and they lost the confidence that childhood vaccination and even the dengue vaccine, it started with the dengue vaccine, but childhood immunization was so much affected that mothers shied away from being vaccinated or from giving vaccination to their children. What happened next in 2019? Whereas we were already almost able to eliminate measles, 800 children died from measles. That, my dear, is what we call disinformation and misinformation that kills. We should not have those children dying. We have already eliminated measles. We have succeeded in that. And yet, when people start saying fake news and misinformation, then you have to be accountable. These people are not accountable for all the things that they say that can really kill. And that is the reason why we, as healthcare workers or even mothers, if there are mothers among you, please tell us on Facebook whether you will really have some problems with telling your family, your children, that they have to be safe. We love them. We love them to be able to grow up well, healthy, and above all, free from vaccine preventable diseases. Those children should not have been victims of deaths and even economic disasters. You know, we have children who have meningitis, and just to make them survive, you have to spend so much until all of your lifetime savings were spent. People cannot just say these things without being accountable for all the deaths and the economic disasters that come in. And we are always influenced by that. You are saying that, yes, there are risks for vaccines. Vaccines are not 100% safe, nor are they 100% efficacious. We know that. We do all the clinical trials. The people need to trust the experts, the vaccinologists, the scientists. We have survived through the years, 230 years of vaccinology, the combination vaccines. There were so many milestones, the polio vaccine, the vaccine against diphtheria, the vaccine against polio, the vaccine against smallpox. Whereas before, they could just lie there and they die there. Now we have all those vaccines. And of course, the most important right now that you are thinking about is COVID. But then you have to look back at history. And this is where I hope you will be influenced by history and by expertise and by knowledge and scientific evidences, not by just pure emotions, not by pure disinformation and misinformation that so abound on social media. Okay, people say, yes, but there is anaphylactic shock, 1 in a million for Astra or Pfizer vaccine. But did you know that those are less risky than being struck by a lightning or being struck by a car when you go out? There is a higher risk that a plane will crash than a vaccine causing anaphylactic shock. People are just so scared that every time they see numbers, every time they see that, they don't really think of what those risks are. And just like benefits outweighing the risk, even if you know that there is about 1 into 188 chances, 188,000 chances that a plane may crash, you're afraid of 1 is to 1 million anaphylactic shock that can occur, but this is manageable, whereas a plane crash, that's never manageable. And yet you're afraid of the vaccine. You have to think about that. That is the reason why vaccine hesitancy has been there, because people do not realize the enormous capacity of our emotions to play around our psyche and our kind of awareness. And that's the reason why the vaccine sometimes begin to be the victim of their own success. Because when they do not see the disease anymore, like right now, COVID is going down. Now people are less eager to get the vaccine because they think that it is no longer as necessary. That is false, because variants could come in. And because if you do not have herd immunity, you can still get the vaccine. The disease. You can still get the COVID. That has happened in measles. When people did not see measles anymore, they said, okay, we're afraid that, it may harm our children. So they did not get the measles vaccine. What happened next? 800 children died in 2019. So you have to be careful. You have to really think and study and see what is really going on. Because once you realize, and once there is again another outbreak, then people will start clamoring for the vaccine and demanding, okay, let's get the vaccine. But it may be too late, because you might be affected. A loved one might die or might have been affected by this. So be very, very vigilant. We all know the history of vaccines. Once you start losing vaccine trust, and you get scared because people who are in social media are scaring all around and doing things that will make your vaccination rates drop, just as what is happening right now. Do you know that we still have 1 million children who are still unvaccinated, less than 1 year of age? That's almost half of the children who were born in the last 12 months. And if we do not make them vaccinated again, we are, under threat of another outbreak of measles or polio or diphtheria or tetanus or meningitis or hepatitis B. We hope that this will not happen. We hope that even before the outbreaks are there, we will be able to make things accessible to our people. There's this taxonomy, they say. I like this because it says 5 A's to be able to bring back confidence in vaccine. And in the parlance, you have this taxonomy of accessibility. See, when mothers are able to access and they're going on a house-to-house campaign, or the mothers are easily able to go to the health center, it's easy. But when the lockdown appeared during the COVID, most mothers said, I am afraid the vaccine is not available. So what did the DOH do? They went house-to-house campaign for measles and polio. And then affordability. But affordability is nothing if the vaccine is free. And that is what we have in the DOH. Of course, if you want a test, you can go to your private practitioner. Go to the private physicians who will be able to give you the vaccine if you don't want to the health center. But of course, they're more expensive because you have to pay for all the pediatricians or the family physicians' clinical expenses. Most of all, awareness. You have to be able to take the knowledge from the experts and you begin to be aware of what is really necessary. Then you begin to accept it. And then you begin to be activated and stimulated. And I hope that it's not just you who will be activated and stimulated. You can impart this to your friends and let them be also part of the solution for our problem of decreased vaccine confidence and increased and decreased vaccine coverage. In the long run, I do believe that we do need to think about the influences that made you what you believe in. How do you believe? You say to see is to believe, but that does not happen. Many times you see what is in the media, but this media, social media, in fact, are not validated. You have seen how many of our social media are saying, someone died after being given the vaccine. Yes, of course, that is partly true. You cannot be saying that after giving the vaccine, you cannot be already succumbing to other illnesses, like you have had previous heart attacks, or you have had previous hypertension, or you have had previous comorbidities. And that happens. It does not mean that if you are given the vaccine, all your illnesses will get well, or that you will no longer have any comorbidity. And that is the reason why vaccine hesitancy comes up, because you are afraid that anything that happens after vaccination is due to the vaccine. That is not the case. And that is where public trust and public education and scientific knowledge comes in. And that's precisely why the dengue vaccine became a very controversial and a very scary part. Because the people behind the dengue vaccine controversy and spread the lies and the fake news made you think that dengue vaccine can kill. I'll tell you honestly, I've been doing clinical trials for 35 years. And the trials on dengue vaccine went through a very important long trials, not only in the Philippines, but in Latin America, in many parts of Asia, Thailand, and Indonesia. There is no evidence at all, even now, that dengue vaccine killed those children that they are saying on social media. That is not evidence-based. And if you believe in that, then you have to re-examine yourself. Because whenever something happens right after vaccination can be coincidental. In fact, this is really what I have been doing in the adverse event following immunization. These are coincidental. They would happen with whether or not the vaccine was given. And this is why you have to think about how do we get to restore vaccine confidence. And sometimes it's not just giving the facts and giving, right away education. You also have to be in a positive conversation. We engage the vaccine hesitant. Sometimes we refrain from saying they are anti-vaxxers because the anti-vaxxers are hardcore people, just like hardcore, something. But sometimes they become hesitant because they hear about this. So you have to listen to them. And to find a solution, you must understand their motivation. If they read it from social media, try to ask them, who is the author of that? And if they don't even know, like even in the US, they are saying that the Democrats are pedophiles or they are also planting some misinformation there. Who are talking? You have to really see, not just, maniwala sa sabi-sabi, walang bait sa sarili. That's how I sometimes think about it. We are intelligent beings. We have the brains, we have the power, we have to think. And of course, we have to start the conversation. And mind you, I really believe that when Pope Francis say that vaccination is an act of love, because he has seen also what misinformation and disinformation is making and resulting in all of this. That's why we have to listen. Even religious groups are now important bringer of correct information that are supported by science, supported by health practitioners who are experts on their field. And by the way, you really need to know and be valued. If you are a health worker listening here, I know you are always the trustworthy. But if you are not a healthcare worker, you can also be a hero because you do not have to share those information and misinformation. What you have to know is to look at the sources of this information and try to figure out why are they saying this? Are there commercial interests? Are there political interests? Are there people who just want to do some, I don't know, vengeance? Or are they really just knowledge, ignorant of all the things that's happening around us? Because in the long run, communication would be the best motivation for us to become heroes in terms of vaccination. I believe that despite all of our knowledge, if we are not able to communicate and communicate well, so as to really find out how do we convince people. Active listening is one. Conversational things are important. And definitely, if you look at this, how do you talk? Do you say a case? Then you have to look at the person and the parent. Are you doing some information seeking? Before doing that, you also have to listen. Now, these are types of things that you might be actually seeing on media. They're part of media training. They're part of all that we do in terms of trying to become influencers. But in the long run, I think it's love. Love for family, love of your fellow men, love of God, love of country, love of people. That's the best way to start a positive conversation. And then you have to be equipped with the knowledge of the facts. As I said, the risks, it is higher, isn't it? So think of that. Those are things that we sometimes take for granted, but they are there to tell us what to believe and how to convince people. because it is not easy. And different social and cultural and political situation exist that will tell you, I cannot really tell you how to do it. I think all of us have our own way of announcing, inquiring, mirroring, reflecting, meditating, and finally securing what we think we should do. Everyone will be a unique person who can become a bringer of confidence, and definitely, if you need experts on this field, we do not lack experts. And as I showed you here, our former Secretary of Health, Esperanza Cabral, is one of our idols for being a vaccine champion. And the PMA president, the presidents of PIDSP, PISMID, all of our civil societies and medical societies, of course the PPS, of course the pediatricians who are right now celebrating World Immunization Week and getting us to be part of the solution to getting longevity, having a long life and quality of life. And these experts are involved and they will respond with transparency, empathy, equity, vaccines for all, not just for the rich and famous, but for everyone, equality. And they will respond with timeliness, with honesty, and definitely with confidence. Ladies and gentlemen, these are the key messages that we hope you will take with you as you go through the months that we still have in order to end this pandemic and improve our childhood immunization. We are missing 1 million children to be vaccinated who are less than 1 year of age. You have to help us become the heroes to shape that public perception on the benefits of vaccine against the risks that they are thinking of. Increase the awareness on the burden of the disease. Oh my God, if you can just see the meningitis cases that we see, the COVID, the MIS-C, the multi-inflammatory cases in children. And for adults, wow, the pneumonia, the severe flu that they might even have. And definitely to dispel the myths and rumors on immunization. Ask the experts, even medical students, the new, are very, very much in on the fact that we need the experts, but they are studying. I love the new sorority for doing this for the last, how many years now? 12 years? They are really part of the solution. And when you go to the community, be aware that everyone can be a hero, just like Nelson Mandela, who said that the life or death of a young child too often depends on whether he is born in a country where vaccines are available or not. Please make sure that the children have the rights to vaccination. You are the adult. The children are our future. Give them a long life, a quality of life in a country that has in previous years made vaccination at the forefront of our health delivery system. Thank you very much.
Thank you so much, Dr. Bravo, for that excellent and inspiring and passionate talk on why vaccine matters. And the Mu Sigma Phi sorority loves you too. It's very, very relevant. And what most of us know is that these kinds of talks, these kinds of conversations aren't really out there. We have a lot of information, campaigns, or we have a lot of instructionals. But you know that the essence of how to engage with our patients or how to have the conversations that really matter, and like what you said, how to communicate in a way that will reach them. So very important takeaways, like Dr. said, positively shape public perception on the benefits of immunization versus the risks, increase awareness on the burden of disease in life and economy, and dispel the myths and rumors on immunization. Think of yourselves as champions, sabi nga ni Doktora. So many takeaways, and we will be discussing this more in the open forum. Please, so for our viewers, if you have any questions, You may send them by commenting on our Zoom, Facebook, YouTube, or through the UP live stream comment boxes. Okay. So thank you, Doctora. For our third and final talk for today, which is entitled Recommended Vaccines and When to Get Them, we have as our speaker the concurrent director of the Health Promotion Bureau and Disease Prevention and Control Bureau of the Department of Health. She was the former chief of the Health Policy Development and Planning Bureau of the same institution. She completed her medical education in the University of the Philippines College of Medicine and obtained a master's degree in public health, healthcare policy, and management from the Harvard T.H. Chan School of Public Health. Among her many accomplishments, her efforts as part of the Department of Health have greatly contributed to the Universal Healthcare Act and the institutionalization of the health technology assessment process in the Philippines. Here to talk about the recommended vaccines for different age groups, please join me in welcoming our next speaker, Dr. Beverly Lorraine C. Ho. Dr. Ho?
Thank you, Dr. Wen, and thank you very much to the Mu Sigma Phi Sorority for this very excellent advocacy work. We're very grateful for all the support that you've provided the DOH and for your strong advocacy, not just for COVID-19 vaccination, but also routine immunization. So my assignment for today is to talk about routine vaccines that are recommended by the Department of Health, but also the vaccines that are available or being procured by the DOH and will be made available for free to all the Filipino people. So, first of all, I'd like to greet everyone a happy World Immunization Week. We've been lucky to have our panelists, Dr. Sanikas, and of course, Ma'am Lulu, in many of the activities during the week. We've seen them in various activities. And we know that the advocacy needs to continue to be stronger. And now we are emphasizing that immunization is really not just for kids, no, for babies and for young children, but it has benefits for all life stages. Now, we want to emphasize that vaccines are ligtas at epektibo and it's for the entire family. Nagbibigay ng proteksyon sa buong komunidad at syempre libre, no, sa mga health centers. At mamaya po siguro mag-share lang din po ako, no, about some private facilities who are helping us out also in administering these vaccines. So, nasabi na po natin, no, na vaccines provide protection hindi lang po para sa babies but all throughout life stages. And so, various vaccines are available for these different age groups. However, we do note that there are selected vaccines that are provided for free or libre, pero may mga ibang bakuna pa na available, no? Pero hindi pa po sila part ng ating immunization program sa gobyerno. So, para sa mga pregnant women, it's important, no, na makakuha po sila ng tetanus, no, vaccine para po hindi po magkaroon, no, ng neonatal or newborn, yung tetanus, yung newborn baby. Kasi pwede po nila to ikamatay, no, within 7 days ng kanilang pagkakapanganak. So, meron din po tayo ng mas marami at mas familiar tayong lahat sa mga vaccines, routine vaccines para sa mga sanggol. No, hindi muna natin pag-uusapan ang COVID-19 vaccine dito, no, kasi alam natin kailangan yon for anyone 5 years and older. No? Meron na tayong 5 to 11, 12 to 17, at mga 18 and above for COVID vaccine. So ngayon naman, ang didiscuss natin ay mga hindi COVID vaccine. No? So for routine vaccines para sa mga sanggol, makikita nyo po dito, no? May mga check marks po kung kailan po pwedeng ibigay yung mga bakuna. So doon muna po tayo sa first column. No? Ito yung mga bakuna na ibibigay para sa mga sakit na maiiwasan. So, sa mga naka-live po sa atin, naka-Facebook Live, pwede nyo na po ito i-screenshot, no? Para meron po kayong kodigo kung ano yung mga gagamiting bakuna. So, you see here, meron pong BCG vaccines na maiiwasan po, no? ang sakit na gaya ng tuberculosis at ibibigay siya sa schedule na yon, no? So at birth, pagkapanganak. Hepatitis B vaccine at birth ulit. Pentavalent, no? Ibig sabihin 50 klaseng antigen ang nandoon po sa bakuna. So DPT, Hep B, Hib, no? Haemophilus influenza B. So makikita nyo, marami pong sakit, no, na may iwasan. Diphtheria, tetano, pertussis, pulmonya, meningitis, at hepatitis. Then may oral polio vaccine at inactivated polio vaccine. So kami po sa DOH, dahan-dahan po, no, yung pag-shift. Dati po, oral polio vaccine na yung ginagamit at ngayon, dahan-dahan na po tayo nagmo-move sa IPV. So, yung oral polio, patak po siya, no? So, then, pneumococcal conjugate vaccine, PCV, at MMR, no? For measles, mumps, rubella, or tigdas, beke, at German measles o tigdas hangin. So, kung makikita nyo, parang ang dami, no? So, ilang beses ba to mangyayari? So, simple lang, kailangan matandaan, 5 beses, no, bago siya mag-1 taong gulang, dapat nakavisit si mommy at si baby, or si baby, para mabakunahan siya. At makikita nyo, no, sa bawat visit niya, hindi po isang bakuna lang yung pwedeng iturok, no? So, pwedeng turok sa magkadalawang side, no? So, right and left, nahita, kunwari po, no? So, for first visit, bibigay natin yung pentavalent, oral polio, at saka PCV. No? Tapos sa second visit, which is 2.5 months, again, uulitin natin yon, pentavalent, oral polio, at PCV. Sa third visit, which is 3.5 months, again, pentavalent, oral polio, introduce na po natin yung inactivated polio, at PCV. No? So, matatapos na natin, tag-3 dose na yan, no, sa first 3 visit. Tapos, from 3rd and 4th visit naman, 2 inactivated polio. No? 4th visit is already 9 months. At by 5th visit niya, which is 1-year-old na siya, natapos na rin niya yung MMR. No? So, MMR is 9 months and 1 year. Okay, so makikita nyo po to, no? May combinations na bakuna para hindi masyado maraming turok, pero safe po, no, na more than 1 turok sa bawat bisita. So, daanan lang po natin yung mga na-mention natin kanina. So, the BCG vaccine, nagbibigay protection laban sa TB meningitis, no, or TB sa utak, di ba? At sa miliary TB. At makikita natin, ang schedule nito, sinabi nga natin, pagkapanganak. No? So, kita niyo yung itsura ng bata, no, sa drawing, na parang kawawang-kawawa, no? At alam natin, sabi nga ni Ma'am Lulu, bakit kailangan natin sila pahirapan kung meron namang mga bakuna? So, sa kanan naman, hepatitis B vaccine, no? Nagbibigay protection laban sa hepatitis, no? Ano ba yung hepatitis, no? Mayroon po siyang pagkamaga, no, ng liver or ng liver ng bata, di ba? At ayaw natin 'to mangyari kasi pwedeng manilaw yung bata, no? At syempre, mas marami po siyang pwedeng komplikasyon. So, itong dalawa, BCG at hepatitis B, yung ginagamit natin, 2 bakuna na kailangan naturok bago makauwi si baby galing sa hospital or sa lying-in clinic. Sa susunod na dito, mga nakwento natin kanina, no, yung pentavalent vaccine at oral polio vaccine. Daanan ko na din, no, yung PCV, protection again laban sa pulmonya at meningitis. So kapag inisip natin yung meningitis, no, sakit siya dun sa parang talukap, no, sa utak ng bata. At kita nyo, sa picture na to, no, tinutusok po yung likuran ng bata kasi kailangan i-test kung nagkaroon ng infection. So, hindi natin dapat na ine-experience to ng bata kung hanggat maaari. So, para hindi po mangyayari yung mga nandito sa pictures na nakikita nyo on screen, bakuna po ang kailangan nila. No? So, sa polio, alam nyo din po, no, yung deformity sa mga extremities at yung peke, mumps, no, yung paglaki dito, at measles, tigdas hangin, itong mga rashes na nakikita natin. Okay? Meron din po ng mga na-approve dito sa DOH na mga bakuna para naman, no, sa hindi bata. So, sa mga mas matandang bata. So ano po yun? HPV vaccine, human papilloma virus vaccine, protection laban sa ibang uri ng cancer, gaya ng cancer po sa cervix, no? Doon sa looban ng cervix ng kababaihan. No? So, ito yung mga cancer na nakukuha mula sa virus na nakukuha sa sexually transmitted infection. So, alam natin na maaari na itong mabigay 2 doses para sa 9 to 14 years old. No? So, meron ng initial run ng programang ito sa DOH. So, layon po namin no, na padamihin yung mga nabibili pong bakuna dito. Meron din pong influenza vaccine or flu vaccine at ngayon, binibili po ito ng DOH para sa mga 60 years old pataas. No? At taon-taon, maaari silang mabigyan, lalo na po kung senior citizens sila. Pero, pwede rin pong bigay ang ating flu vaccine taon-taon no, para sa less than 60 years old pababa. Pero dahil iba yung kulay dito, ibig po sabihin, no, hindi pa po siya kasama sa nababudgetan natin. Para naman po sa PCV or pneumococcal vaccine, meron na rin po tayong programa dito, isang dose lamang para sa mga 60 years old pataas at kasama din po ito sa programa ng DOH. No? So, currently, it's also only for indigent senior citizens at ang balak po natin ay continues to i-expand para lahat ng senior citizens maaari pong maka-access. At sabi nga kanina, pwede nyo pa rin naman to kunin no, sa private practitioners ninyo, pero layo ng DOH na maging libre po itong mga life-saving na bakuna. So, I'd just like to close this presentation by emphasizing that vaccines, all of what has been presented, are safe, effective, protective, and free. No? Meaning there are other vaccines that are still available in the market, but they're not part currently of the free program of the Department of Health. At kahit sinasabi nating merong mga side effects, yung pagbabakuna gaya ng pamumula, no, dun sa lugar kung saan ka binakunahan, lagnat, pagkahilo, pamamantal, makikita natin na meron pong mga manageable na pwedeng gawin no, sa bahay bago po natin tawagan yung ating mga midwives, public health nurses, or healthcare worker na nagbigay po sa inyo. No? So, kunwari po, dun sa pamumula sa parting binakunahan, maaari po itong gamitan ng warm compress, di ba? So, mainit na bimpo, ilagay dun sa lugar na yon para po ma-relieve no, yung kirot. At kung talagang mag-persist pa yung kirot, maaari naman pong painumin no, ng paracetamol, yung bata or yung nakakatanda, pwede rin pong uminom. No? So kapag lagnat, magbigay din po tayo ng paracetamol. Pero kung lumagpas na po ng 3 araw na paulit-ulit pa rin yung lagnat, no, maaari na tayong kumonsulta sa health center. Same way, pagkahilo at pagkapagod, ipahinga yung pasyente no, at obserbahan at bubuti din usually no, yung pakiramdam nila within 24 to 48 hours. Kapag may pamamantal naman na may kasamang paghirap ng paghinga, no, kumonsulta agad sa pinakamalapit na health center. Gusto po din namin i-emphasize no, na kasama po nitong pagbabakuna ay dapat po magkaroon po ng regular no, na pagkonsulta sa ating health center kasi hindi lang naman din po bakuna yung kailangang ma-receive na service ng bata, teenager, or nakakatanda. Right? So, para po sa ating catch-up vaccination, kasi sinabi po ni Doc Lulu kanina, no, medyo marami-raming bata, halos 2 milyong bata in the span of the 2 years during the pandemic, ang hindi po no, nakakumpleto ng kanilang bakuna. Yung pinakita ko po sa inyong 5 visits, hindi po nila yon napuntahan lahat. No? At kung patuloy po na ganon, malaki po chance talaga na magkaroon tayo ng mga outbreak nitong mga kasong hindi na dapat no nagkakaroon ng outbreak like measles. So dahil dito no meron po tayong catch-up vaccination this April, May, and June. No? So there are dates indicated here. Gusto po natin mabakunahan yung karamihan ng mga bata, at least 80%, of the 1.1 million infants na hindi po nabakunahan noong 2021. No? Tapos syempre, meron pa tayong hindi nabakunahan noong 2020, at the height of the pandemic. So, ngayon po, ngayong araw na to, tsaka bukas, meron po tayong bakunahan in selected provinces, dun sa may pinakamatataas na hindi na bakunahan, pero May 26 and 27 and June 23 and 24. So ito ay last Thursday and Friday. No? So yan po, meron pong nationwide vaccination. So kung sa COVID-19, nagkaroon po tayo ng National Vaccination Day, meron din po tayo na Chikiting Vaccination Days. No? On other days dito, maaari pa rin po naman kayong pumunta sa health center. Mas marami lang talaga kayong makakasamang mga ibang classmate na mami tsaka bata dito sa ating mga National Vaccination Days, at makakaasa po kayo na maraming masasayang racket na makikita sa inyong mga health center sa LGU. So, gusto ko na pong magtapos ng presentation. Pero maaari nyo rin pong puntahan itong site na to, www.healthyfilipinas.ph, para po sa mas marami pa pong mga resources na pwede nyong gamitin. So para sa mga magulang, may mga videos dito at mga materials. Para naman po sa mga guro at healthcare workers na nakikinig sa atin, pwede nyo rin po itong maging reference ng mga materials na pwede nyong magamit sa mga pasyente nyo po, kunwari. So, maraming salamat po ulit sa Mu Sigma Phi Sorority para sa pagkakataong ito. Back to you, ma'am.
Thank you so much, Doc Bev, for that very informative and practical on-the-ground advice. Naki-screenshot din ako. Nung sinayo mag-screenshot ng mga, kasi I'm an obstetrician, gynecologist, dapat alam ko rin yan. Pero syempre, yung mga immunization ng yung mga routine immunization para sa mga sanggol, hindi ko na memoryado yan. So I hope na lahat din ng mga nanonood, na kapag, these are very practical and on the ground kasi advice, both for the healthcare providers and also the patients. Napansin nyo ba na many of them, they are easily understood by our patients, but at the same time, they are also very informative for the healthcare provider as well. So napakarami nating mapag-uusapan mamaya, So we now move on to our question and answer segment, and we'd like to call back our 3 esteemed speakers to join us. So let's welcome back Dr. Melvin, Dr. Lulu, and Dr. Bev. So again, for our viewers, if you have any questions, you may send them by commenting on our Zoom, Facebook, YouTube, or through UP live stream. Please indicate if you would like your question to be answered by any of our specific speakers. Si Dr. Sanikas, Dr. Bravo, and Dr. Ho. Okay, so sa ating, meron kasi tayong Q&A, itong ating webinar, meron tayong separate na Q&A section, And right now, we have one question. We have some questions from the registration, but we have one question here na siguro doon tayo mag-umpisa, and this is for Dr. Bravo. I will read the question and then I will reframe it para mas madaling intindihin. Okay, so good afternoon, Dr. Bravo. I had my first AstraZeneca, this is COVID vaccines, AstraZeneca dose, first dose March 2021, second dose in June 2021, thereafter. But because of fear of deaths from the nearest of kin and close friends, I decided for the third dose, Moderna, in November and December 2021. Please comment on when I should get my vaccine for 2022. So i-reframe ko ha. Ang ibig sabihin na ang ating nagtatanong, edi nag-complete dose siya ng AstraZeneca, March and June 2021. And then kasi kinabahan siya, parang gusto rin niya mag-Moderna. So dito, nag-Moderna rin siya ng November and December. So actually, she has 2 different COVID vaccines and she has complete vaccination for that. So, Doc Lulu, pag ganito, tinatanong niya ngayon, di ba naglalabasan yung balita sa booster? Paano niya ngayon gagawin? What would you advise for her and people like her who actually have 2 complete separate COVID vaccination, complete vaccination, and then ito may balita na dapat mag-booster. So lalabas, nakaka-4 na siya. 2 Astra, 2 ano pa yung isa, Moderna. does she have, and any of our speakers can also chime in after Dr. Lulu.
Actually, when ang sasabihin ko kung nakadalawa na siya na Astra, nakadalawa na siya ng Moderna, alam mo sabihin ko sa kanya, please, awat na. Simple lang. Awat muna. In the first place, ang ating recommendation ng DOH officially is ang third dose, which is the first booster, na ibigay na yan. Yun yung nakuha niya noong November 2021. Heterologous ang tawag doon. It's a heterologous because he started with Astra and then got a third dose of Moderna. And there is no recommendation as yet. If he is not immunocompromised, right, to get a fourth dose. Nakahang pa yan. I'm sure Beverly can also mention that. But as far as I know, we only give a fourth dose right now to immunocompromised. Baka ang susunod dyan, elderly. I don't know how old he is. Ako nga, elderly eh. I'm 72, you know. I'm waiting for my fourth dose, Beverly. But I am not getting it until there is an official recommendation. So, medyo sumobra na nga siya eh.
Naiintindihan ko, Doc Lulu, siguro kasi sa pananaw ng ating mga, sa ating mga kababayan, pag consider na complete, parang kailangan nilang kompletuhin yung, kunyari, yung 2 doses, ganyan. Tapos, iba pa yung gano'n. Yun ang... Yes. Okay. So, tama-tama po.
Don't do it for the self-medication thing. Just like, you can take aspirin and antibiotics because you think that is the right thing. No. Our thinking is always ask for the official one. Ask the experts. The DOH. And well, I'm giving way to Beverly. Beverly, it's up to you.
Yes, tama-tama. DOH are the experts. Di ba, Doc Bev, nagkalalabas lang ng guidelines ng memo on who to prioritize for the booster and exactly how to implement this. Di ba, there are certain sectors. So maybe you'd like to explain that for us and the viewers.
Thank you, ma'am. Yes, tamang-tama po yung sinabi ni Doc Lulu, no? So tayo naman, yung recommendation natin, lagi po, no, isinasalang-alang natin yung mga ebidensya na lumabas. At syempre, lalo na, no, yung HTA Council, kasi po based on the law, no, sila yung last expert group na magre-review at magre-recommend. So far po, ang nirekomendan lang po nila na magkaroon ng second booster dose ay yung mga immunocompromised po. No? So, kung hindi po kayo part ng group na yon, hindi pa po natin nire-recommend na mag-second booster dose. Kung excited po kayo magpabakuna, pwede bang yung energy ay ibigay na lang sa pag-recommend, no? Or pag-convince dun sa mga iba pa nating kasama na hindi pa po nag-first dose ng booster kasi sila po yung kailangan natin na mabakunahan. Pero ma'am, kung naka-2 boosters na po kayo, okay na po kayo for now, no? Hindi na po kailangan ng additional.
Diba? Beverly, awat na muna. Awat muna.
Yes, ma'am. Yes,
ako nakakatatlo pa lang. Ako nakakatatlo pa lang, Beverly. Naghihintay pa ako ng pang-apat.
Okay, so doon sa nagtanong sa atin, unang-una, we commend you, no, for being very you really acknowledge the importance of vaccines. Tapos, but now at this point, we'd like to reassure you na yung 2 complete doses mo of AstraZeneca and yung 2 complete doses mo of Moderna will actually suffice. Actually, lamang ka pa eh. Kasi yung first dose mo ng booster na yung first dose mo ng Moderna, parang booster mo na yon, heterologous. Tapos nadagdagan pa, nag-fourth, naunahan mo pa kami. Pero good yun. Pero siguro, muna, awat muna. Oo, tapos let's wait for the official recommendation. Yes, Dr. Lu.
Let's talk naman. And if she could talk with us, I would be...
Yeah.
Kasi sabi niya, natakot siya. Natakot siya dahil may nabalitaan siyang namatay sa social media. That's the one that we have to address at this point. Okay naman, hindi naman masama na nakakuha na siya ng 4th dose kasi sa Israel, nag-uumpisa na silang mag-4th dose. Okay? Sa ibang parte ng mundo, wala pa WHO does not recommend a fourth dose. So, awat na muna doon, right? But I am more inclined to think, let's talk about what happened. Why is she afraid of that news na meron daw nagkasakit na matay? You know, I am with the adverse event following immunization noong 2021. Tinutukan namin yung mga nagkakaroon ng tunay na adverse event. Karamihan nga doon coincidentally. So, yun yung sinasabi ko kanina na siguro we have to really rethink kasi ang dami-daming nagkakalat talaga ng fake news, disinformation. And as we know, this is not going to be easy because disinformation can actually kill. Kasi pag hindi ka naniwala at ang pinaniwalaan mo, ay wag na lang ako magpabakuna, nakakamatay pala yung bakuna. O tapos yung pala, yung kanyang 60, 65-year-old, hindi nagpabakuna o na COVID. Aba, ay mas grabe yun. Kasi hindi lang sa nanganganib ang buhay mo, ang gagastahin mo pag na-hospital ka, aba, 100,000 pesos per day pag na-intubate, no? Di ba? Gusto ko lang malaman saan niya nakuha yung balita at kung yun ay valid. Yun lang naman ang gusto ko. Kasi talagang kami dun sa NAFIC, yung National Adverse Event, talagang iniimbestiga natin. Pinupuntahan natin yung mga epidemiologists, sila yung tumitingin. Ano ba talagang nangyari, kuya? Parang ganun. Tinitingnan mo talaga, iniimbestigahan mo. Kaya itong mga eksperto sa regional at saka sa national, and again, I go to Beverly to endorse that. Kasi baka sabihin nyo, ako lang nagsasalita, akong sinasabi ko nga lagi, pag hindi ka sinuportahan ng DOH o hindi sinabi ng DOH, tama yung sinasabi mo, mali ka. Di ba? So, I thank Beverly for saying that. Kasi hindi po porket narinig nyo, tama. Yun lang naman. Ako, kung mali man ako, I stand corrected. Pero lahat po ng mga adverse event ay dapat nire-report at iniimbestiga po yan kung talagang may nangyaring hindi maganda. At yung pong mga naglalabas lang sa social media nang wala namang valid, na maari pong nananakot at sabi-sabi lang. So yun nga po ang mahirap kasi pwede po tayong magsalita ng kung ano-ano pero wala po tayong accountability kasi. Dapat pag kami sinasabi kang mali at nakakamatay, dapat may accountability yun. Yun lang ang gusto ko. Kung merong batas na mangyayaring ganyan, pag nagsalita ka ng hindi totoo at nakamatay yung sinabi mo, aba ikulong ka na sa preso, 'di ba, Beverly?
Kailangan may resibo, no? Yung mga sinasabi natin.
Doc Lulu, tinignan namin kung sino yung nagtanong, no? So this is a public service announcement kasi ang pangalan ng ating nagtanong is si Anonymous attendee. Syempre, nasa sa kanya yon if gusto niya mag ng kanyang identity. So babalikan namin po siya, no? So to the one who asked the question, maybe can you get in touch with us sa chat if you want to explain the circumstances. So before, while waiting for you, siguro we will move on first to another question. Pero babalikan ka namin, we can have you explain the circumstances live. Okay? So right now, maganda, no? Dumadami ang ating questions sa chat. And at this point, anyone can answer. So, Doc Mel, isasalang kita mamaya. Pero meron ako munang gustong itanong, no, doon sa kasi meron siyang live question na not from the Zoom, so hindi niyo nakikita, pero from the other platforms. May tanong sa ito, from the lens of someone who is currently affiliated with a pharma company, what lessons from the past, ako tamang-tama sa talk mo, na what lessons from the past can we use to address anti-vaxxers who believe that vaccines are only money-making schemes of big pharma? No? Kasi nakaka-contribute itong mga to doon sa sinasabing disinformation and misinformation. Na ang sinasabi nila, marami silang sinasabi. What are your thoughts on this? And coming from being affiliated with pharma, and how would you address this or correct their misconceptions?
So I guess akin yan, Doc Wen, no? Kasi ako
yes,
yung
Doc
pharma.
Melvin.
Okay.
Yes, and sa'yo rin yung history.
Yeah,
from the lens of the past. Oo.
So I would think na ang pagsagot sa ganyang question, different buckets. Yung isang bucket siguro to emphasize yung sinabi ni Ma'am Lulu kanina na talagang yung economic benefit ng bakuna is enormous, no? Like a few dollars of vaccines, yung kumbaga economic benefit niya for the person, for the family, for the community and the country is huge. That's one. Secondly, siguro the other thing that I want to say is yung vaccine kasi, yung vaccine industry, actually hindi siya ganun ka profitable as people think. Maraming mas profitable na medical interventions. Let's say, kunyari, oncology is one. The other one is rare disease. In Europe, for example, you can have a treatment for a very rare disease na ang presyo is 200 to 300,000 euros a year. Ganon, just for one person. And you know, with that amount, you can actually vaccinate maybe a whole cohort of children in Africa, for example. And the third thing, siguro, kung talagang totoo na profitable ang vaccine industry, then we should be seeing many countries doing this, na sila nang mismong gagawa, diba, ng mga bakuna. But we're not seeing that kasi the investment in creating vaccine manufacturers and vaccine research is huge. And yung mga countries, niisip nila na instead of doing this, creating their own vaccine manufacturing company, for example, can be used in something else, kung ano man ang naisip ng gobyerno. And this is from a study I read yesterday. Sinabi na with this COVID pandemic daw, ang estimate ng World Economic Forum is that mga 14 trillion ang kumbaga ang cost nitong pandemic na to. So if you compare this 14 trillion to a few billions or millions worth of creating vaccines, di ba napakalaki ng benefit, no, of getting the vaccine. So what I'm trying to say is mahirap siya, parang naging strawman argument siya, di ba, na parang sinisimplify masyado na, uy, wag ka bumili ng bakuna kasi it's a money-making scheme. Well, you know, all companies na hindi non-profit talagang kumikita naman, di ba? Hindi lang ang bakuna. We have let's say yung industry ng mga vehicles or industry ng, let's say, food. You need to earn to be able to continue the business because it's a business. But at the same time, the money that you spend buying vaccines actually is giving a lot more than what we see in terms of benefits sa tao. You prevent infection, you prevent disease, indirect cost sa pamilya, kunyari na nagkasakit yung anak, di ba? Maraming gastos yan, tapos yung parents kailangan pumunta ng ospital, kailangan mag-absent sa trabaho. So all these direct and indirect costs dapat tingnan natin when we talk about the price of vaccines and vaccination. So yun, medyo long-winded siya pero kasi it's a complex topic.
It's complex and actually hindi naiintindihan ng ibang ng karamihan ng common na ang research and development in vaccine, not just in vaccines but also in development of drugs, ganyan. Kailangan na talaga ng investment, di ba? Kasi kailangan niya ng pondo. And most of the pharma companies, they really have funds for itong research and development. And it runs into millions or billions, di ba? Pero hindi naman siya ibig sabihin na gumagawa ng pera, pero you really need funds. And there's another question, no, related, kasi nga anti-vaxxers, no? Sabi niya, some of my family members are anti-vaxxers. Sabi nila, kasama sa top 3 daw po ang pumapatay sa mga Americans ay medical malpractice kasama ang vaccination. May related ito doon sa mga sinasabi kanina ni Doc Lulu, yung mga mis and disinformation. Sabi, healthy lifestyle is enough for longevity. Sabi nung question, yung nagka-question sa atin, sabi daw nung mga kamag-anak niya, healthy lifestyle is enough for longevity. Vaccinations are for the longevity of big pharma. How could I convince them otherwise? And I think kanina sa talk ni Doc Lulu, marami siyang nabanggit, di ba? Kasi una muna, kailangan, di ba Doc Lulu, you said something about you have to distinguish between those who are hesitant and the hardcore anti-vaxxers. And you have to have the correct, the right convos with the ones who are hesitant. That's why we are trying to look for the ones who asked the question kanina. Pero sa mga ganito, itong mga hardcore anti-vaxxers, ang tanong, una muna, ang tanong niya kasi, how do I convince them? Isa pang tanong is, should you work on convincing them? Or should you put your efforts into convincing the anti-vaxxers, the hardcore ones na nabanggit ni Doc Lulu? Or should we put our energies pa? What do you think? Kasi some of these, alam mo yung minsan, ang feeling mo, pag anti-vaxxers, they have this mindset. Kasi mindset, ano na yan eh, it's a mindset thing. They have this mindset and they are so convinced about this. Do you think they are worth convincing? Kasi we want all people to have the vaccines, right? So how about, we've talked about the hesitant, the ones who are hesitant. But what about the hardcore ones? The hardcore anti-vaxxers who sometimes who many times create the disinformation or misinformation. How do we address that? And I'd like to ask our panelists, paano kaya yun?
We
Yes,
have
Doc Lulu.
a principle for that.
Yes, Doc Lulu.
In fact, this was attributed to one of the biggest vaccine champion of all. Beverly, si Car, yung nasa PAHO na very, very important, the 𝐈𝐻 vaccine, oh my God, it escapes me. But he says, and every time he talks about vaccine, anti-vaxxers, he says, do not go to the pig pen. You will be mudded and the pig will like it. So wag na raw pong maglaro doon sa pig pen ng mga anti-vaxxers. Kasi they will just love you na ikaw pati ikaw ay maputikan. So, wag na lang po. Iba po yung anti-vaxxers kasi usually meron na yang interest na naka-hardcore nga eh. Either commercial, political, or something else. So, mahirap pong talagang kalabanin yon. And we don't really try to do that. But for a conversation, yung vaccine hesitant po, na talagang nakabasa lang siya ng hindi maganda, and you are now trying to figure out ano bang nangyari. In the same vein that, you know, i-correct natin sana, bibigyan natin sila ng mga facts na nakita nyo kay Dr. Beverly, nakuha nyo kay Malvin, nakuha nyo kay Ana Onglim, nakuha nyo sa mga nagiging na eksperto. At yun po ang maaring makapag-convince sa kanya kung siya po ay nakikinig. Siya po yung talagang skeptical. Sabi nga nila, there's a difference between a skeptic and a cynic. Yung skeptic, yung po yung mga vaccine hesitant, natatakot lang. Yung mga cynic, meron na yung interest na mahirap po na baguhin pa. So, don't get mudded. Huwag na kayong magtampisaw sa putik.
Medyo kasi masalimuot yung inyong dadaanan. Pero for those who are hesitant, sabi nga ni Dr. Lu, engage with the hesitants, no? Try to understand their motivations and start that conversation, have that conversation. So now we're moving on to other live questions. Ito naman ay may kinalaman. This is for Doc Bev. Kasi may kinalaman din to na you mentioned kanina yung chikiting vaccination, di ba? Yung catch up. So ito, excuse me, I'll read the question and then I'll also reframe it. So ang question niya, exact question niya is, my 12-year-old daughter has G6PD and I've been hesitant to have her vaccinated because of this. But I want her to catch up with her vaccinations. Will it be safe for her to receive all that she missed? Now, ang reframing nito is, what about children who, kasi ito we're talking, if well baby or walang medical problem, hindi masyadong problema. But what would you advise parents of children who have medical conditions on catch-up vaccination? How do they go about this? Pag kunyari, gusto nilang humabol, pero meron silang medical condition yung mga bata. Like G6PD.
Thank you, ma'am. So, sa mga parents po, mahalaga po na meron kayong regular na primary care provider or pediatrician. Kasi sila po talaga yung nakakakilala dun sa mga kondisyon ng mga anak nyo para ma-advise nila kayo palagi. No? So for example, sa G6PD, in terms of COVID vaccination, no? Hindi siya contraindicated. Ibig sabihin, pwede siyang mabigay, pero usually, no, we will require certification from your pediatrician that you're cleared, no, to take these vaccines. Kasi, minsan hindi lang po yun yung condition nyo, no? So, mas nakakabuti talaga yung may kakilala na sa inyo yung nagki-clear nung condition na yun. So, I think in summary, we really just wanted to say that it's important to have your own physician to clear you to get certain vaccines. Over, ma'am.
Yes. So yan, especially since merong condition yung anak ninyo, di siguro we also presume that he or she is receiving medical attention or care for that. And you can ask your pediatrician, sabi nga ni Doc Bev, how to go about the catch-up vaccine. Kasi syempre, mas kilala nila yung kaso nyo, mas mabibigay yung advice. Now, our next live question is for anyone in the panel, and it's a general question. Kasi sabi, yung ibang vaccines, they took years to be developed. How come yung COVID vaccines were produced quickly? What changed? And how safe it is to produce vaccines this fast? Very interesting. Often asked question. So, sino po ang gustong sumagot nun? Bakit
Okay,
nga ba napakabilis?
Okay, I can start maybe Doc Wen.
Yes. Sige, Doc Melvin.
Ma'am Lulu and Doc Beverly can add. So, firstly, yung SARS-CoV-2 po, the virus that causes COVID, hindi po siya yung first coronavirus. Meron na po dati yung SARS-CoV-1, yung MERS, na same family sila. So, because nangyari yun ng 2002, yung SARS, and then yung MERS is 2012, yung scientists po na nag-aaral sa coronavirus, hindi na sila, kumbaga, hindi na bago to. Alam na nila yung spike protein, alam na nila yung receptor binding domain, and all the parts of coronavirus. So that's one. Secondly, yung science din po nag-evolve eh. So, di ba yung mRNA vaccine na unang lumabas sa market, yung pag-aaral po niyan talaga since 1960s, but because of the improved scientific, bali yung science, nag-improve na rin the past decades, it was possible na to really create these kinds of vaccines. Ang una nga po na ginawang mRNA vaccine was actually a rabies vaccine, pero wala pa siya sa market. Pero hindi po ito ang unang-unang mRNA vaccine na ginawa. Thirdly, the amount of money na talagang nilabas ng governments, ng foundations like the Gates Foundation or Wellcome Trust, I think the last time I checked, it was around 30 billion na so far ang nilabas. So if you have this amount of money na hindi na siya nagiging, kumbaga, bottleneck for research, you can actually do a lot. Kasi ito, explain ko po in a non-pandemic situation, ang nangyayari is, gagawa ka ng bakuna mo, tapos gagawin mo yung animal studies mo. After you pass the animal studies, gagawin mo yung phase 1, gagawin mo yung phase 2, phase 3, but in all these stages, kailangan po ng pera. And for the money to arrive, kailangan mo mag-apply ng grant. And all these things, matagal to eh. You need to do the study, get the results, apply for funding, repeat for all the stages. Kaya siya matagal. Pero with COVID, hindi siya issue because, ayan, billions and billions of dollars ang nilagay. Thirdly, yung isa pong innovation na nangyari with COVID is that previously, gagawa ka ng vaccine, ng animal studies, phase 1, 2, 3. Ang nangyari ngayon, nagiging parallel siya. Instead of doing that one after the other, yung phase 1 tsaka 2 ginawang parallel, yung 2 tsaka 3 ginawang parallel. So, nakasave ng time. The other thing is, yung regulatory agencies in a normal non-COVID situation, it takes 12 months to 18 months for them to review a dossier. But this one, kasi sobrang, they were working closely with the researchers. So, kumbaga, natapos yung unang part ng study, binigay na kagad yung results. Natapos yung second part, bigay na sa kanila yung results. So, they were reviewing this in a rolling submission kind of review. Ibig sabihin, hindi na nila kailangan antayin lahat ng studies matapos bago mag-submit. And yung collaboration talaga na nangyari with COVID has never happened before. No, with other diseases, di ba? Madaming labs na gumagawa on influenza, HIV, tuberculosis, malaria. But when COVID happened, all of these groups, they stopped what they were doing and they focused on this one thing. And it never happened before in human history. So talagang this is collaboration, a lot of money, a lot of funding. Tapos nagkataon din na yung mRNA technology parang hinog na siya for this. At yung viral vector technology din, hinog na rin siya for this. So kumbaga parang the stars aligned actually. And sa totoo lang, in the first few months of the pandemic na wala pang bakuna, when I was speaking to many of my vaccine developer friends, vaccinologist friends, hindi rin sila actually talaga sure na these vaccines will work. Kaya parang medyo yung confidence level pag ini-interview yung mga tao before, sinasabi nila na maybe it will take 12 to 18 months. So nagulat din ng mga tao actually that this mRNA vaccine actually really worked very well, di ba? 95%, 93%. So I would say that all these factors plus luck, or siguro, I don't know, maybe God blessed us na magawa din yung bakunang to. So all these many factors and all the stars aligned for this vaccine to be done. Pero hindi po ibig sabihin na for the other diseases ganito rin. Maybe for the other diseases hindi ganito. Kaya nga wala pang HIV vaccine, for example.
Yes, very interesting. And that's true, no? Actually, I believe, malaking bagay yung research and development talaga. Not necessarily focused sa COVID, di ba? Kasi, for example, hindi siya vaccine, pero like molnupiravir, Emory started it as an antiviral. It was not really meant for that. But alam mo yun, yung opportunity favors a prepared mind, di ba? Kaya yan na fast break kasi they already had they had studied, parang they didn't start from scratch. Yun ang sinasabi ni Doc Melvin, di ba? Marami tayo na parang nag-pivot sila to work towards the production of the vaccine. So maswerte rin tayo, no, na it worked to a certain degree. Pero ganun talaga yung na-explain naman yung proseso. So I'd like to ask the thoughts of Doc Bev and Doc Lulu dun sa nabanggit ni Doc Melvin. This would help our audience understand yung emergency, yung hindi naman ito porque napabilis, ibig sabihin na merong shortcut na hindi naman nang makasasama o na nagpabanjing-banjing na bigla na lang ni-rush, di po ba? So, any thoughts po?
And
yeah. Doc Lulu, yes.
The history of vaccinology through the years that Melvin has been saying tries to save lives. We want to save lives. And the reason there is continuing vaccine development, kaya po tuloy-tuloy ang pagbabakuna at pagpananaliksik, is because as soon as you have a very severe disease that can kill, just like COVID and Ebola, and all the other avian flu and H1N1. The ideal is to be able to get a vaccine within 6 months. Can you imagine how many already died within 6 months of COVID? That was the principle ever since. If you remember with the avian flu, people were saying, okay, if we have a new flu, an avian flu, they need to get the vaccine ready within 6 months. And precisely, the COVID was a miracle. And we are really thankful. Again, first to God and for the people who produced all the resources, the scientists, even China, although it originated with them, they were able to produce the genetic code for the coronavirus too. And they shared it to the world. Did you know that? Did you know that China actually shared the genetic code? If not for that, it will be very difficult to get a vaccine going. But in January of 2020, China released the code that was used for the mRNA Pfizer vaccine. If you will remember, that code was used in Germany and in the US. And that's because the human mind is very, very intelligent. I think this is what we have to be thankful for. God gave us a very, very intelligent mind, and we should not question that. Over.
Yes, and we should thank you, Doc Lulu, and we should also highlight the importance of collaboration, di ba? Not just in all aspects, in scientific research, in implementation. We cannot operate in silos. Now is not the time to do that. Within every at all levels, whether it's international level, globally among nations, or even in our institutions, in departments, we cannot operate in silos. There has to be collaboration. Okay, Doc Bev.
I think from our end, no, gusto lang din namin i-assure everyone that there's actually a regulatory process and even evaluation by different expert groups. So we have actually as much as 5 expert groups constituted, no, one after the other. They evaluate the products that are coming into this country for COVID-19, particularly the COVID-19 vaccine. So hindi din naman na basta may na-produce, no, go lang tayo, 'di ba? Meron din pong pag-aaral na ginagawa para din ma-reassure kayo, no? Kasi kami din as public health authorities, ayaw din naman namin na sige, kung ano na lang ginawa ng ibang bansa, gagayahin na lang natin, 'di ba? Basta-basta, no? So we also have our very own set of experts who are helping us evaluate, helping the government evaluate. And they're not all part of DOH, no? So marami sa kanila ay independent experts. So you really get an unbiased opinion. So I think it's also important to emphasize na apart from these expert groups, siguro our own experience should let us know na napoprotektahan tayo, no? Anong example? Karamihan sa ibang bansa, kapag masyado nang matagal dahil naging successful yung vaccines, hindi na nila nakita kung anong ibig sabihin ng polio or measles, 'di ba? Kasi matagal nang wala, no? So minsan siguro kailangan i-review natin yung nangyayari sa history na actually dati ang daming nalulumpo dahil sa polio. Ngayon, mas di na natin kita or matatanda na yung mga nalulumpo na nakikita natin kasi years ago na sila. Pero during this COVID-19 crisis, nakita naman natin kung gaano nakainaba yung buhay natin nung March 2020 sa ngayon, no, April 2021. Hindi na tayo gaanong takot, no? Syempre may konti pa rin, pero we can all continue to see our family members, 'di ba? We don't have to test as much, be super super afraid, no, and lock up in our homes. So I think these are very tangible. Kahit hindi mo tingnan yung studies, no? Sa atin lang, no? Na meron kang confidence na lumabas yung lolo't lola mo or tatay-nanay mo, no? It matters a lot. And that's because of these technologies. So on a more practical sense, nararamdaman natin yung impact eh. So hindi natin siya pwede sigurong maliitin lang kasi nangyari yung impact sa atin. Over, ma'am.
I agree. And hindi ba talaga tama naman. Kaya maganda yung pagkakasunod-sunod ng talk, no? Nag-umpisa tayo yung looking back in the history. Kasi actually, it's very iterative, you know? Kung ano yung nangyayari, you know, these are lessons from the past that keep on coming back in one strange spiral. But each time, we have learned our lessons by that time and we can apply this kapag dumating ulit. No, how many pandemics na, how many lessons we've learned from vaccination. I have 2 questions in the chat that are related and anyone can answer. And this is on boosters, no? Boosters. So ang una, I'll read the questions as they are written down. Yung isa ay, good evening. I'm done with AstraZeneca primary series and now 6 months have passed since the second dose. My question is there a peer-reviewed study on what booster shot to avail so I can have a good boost with COVID immunity? And then there's a related question. Are healthcare workers recommended to have a second booster? So the first question is, meron bang peer-reviewed study daw on ano yung booster, the first booster na magandang boost? And the second is, yung second booster, ang healthcare workers ba ay dapat tumanggap. So, or recommended to have the second booster. Sinabay ko na para isang bagsakan na lang yung booster questions. So, who would like to answer that? Any of the members of our members of the panel? Meron bang recommendation na ano ba yung best pang-boost? Siguro yung mga homologous, heterologous, tinatanong nila, or ano yung either that or ano ba yung recommended sa atin for boosters? Who would like to?
Maybe
Yes, Doc Bev.
I'll
Okay.
answer very briefly, and then I'll just look for this infographic, para on
Okay.
guide dun sa booster.
I'm getting my ready for the screenshot.
So sa atin lang, sabi ko nga, so regardless, we wait for the experts' reviews. So at this point in time, the HTAC recommends only immunocompromised patients to take the second booster. Nakasalang na po yung evaluation nila para sa senior citizens at para sa healthcare workers. At gaya nyo, kami din naman excited na i-roll out siya. Pero syempre consistent tayo sa mga proseso natin. So we're just waiting for the HTAC to issue out the recommendation. So the short answer is no, it's still not recommended.
Thank you. No, wait for HTAC recommendations. What about yung first booster? Any of our panelists, meron na bang siguro parang kasi kako-complete lang niya yung series. Meron bang recommended vaccines for the booster na parang among the existing COVID vaccines as booster? Meron bang question na is there a peer-reviewed study on what booster shot to avail so I can have a good boost with COVID immunity? So ang primary series niya is AstraZeneca, 2 doses of AstraZeneca. Is there a study that recommends what booster to give? Preferred booster. Yes, Doc Melvin, I see.
Oh, yeah. Doc Wen, so AstraZeneca yung una niya, yung primary vaccination niya. Actually, good news about this is AstraZeneca, siya yung one of the pinaka widely used vaccines, COVID vaccine in the world. So madaming actually studies nito. Meron from Brazil, meron from India. And ang good news I would say is kung homologous boost, meaning AstraZeneca yung first 2 mo, tapos AstraZeneca din yung booster mo, you see a boost, no? Tapos kung heterologous siya na kunyari AstraZeneca yung first 2 mo, tapos nag-mRNA ka after Pfizer or Moderna, maganda din yung boost. So yung bottom line, I want to emphasize na kahit na ano yung i-add mo after sa AstraZeneca, either AstraZeneca man or mRNA, maganda yung boost na tumataas talaga yung antibodies after. So the other thing I want to say is masyado tayong naging focused on antibodies kasi yun ang mas madaling i-measure. But in reality, ang immune system natin hindi lang antibodies. No? We have T cells, B cells, and many other cells in between that help us fight pathogens. So ngayon, may mga studies na lumalabas from the US, from UK na looking at T cell immunity. At very reassuring ang results kasi pinapakita na kahit na yung antibodies nag-wane, which is normal, kasi talagang even if you vaccinate anyone, kahit bata or matanda, talagang antibodies, you expect that to decrease over time. Pero ang pinapakita with the T-cell immunity studies is that yung protection is still maintained because of these other cells na hindi lang antibodies. So I think gusto ko lang sabihin na while it's good to look at the antibodies, hindi lang po siya ang important component ng ating immune system.
It's a very important takeaway. Hindi lang siya ang very important, no? So for our last question, we have so many questions, but I have time to ask this one last question. Ay, ito na. Doc Bev, I'll give this to you first. The floor is yours.
Okay po. Thank you, ma'am. Medyo, komplikado kasi actually marami tayong bakunang ginamit sa Pilipinas, di ba? So it was our way to cope with the shortage of vaccines globally. So screenshot nyo na lang siya kasi mas mabilis, no? Kung at your own time. Makikita nyo dito, first column is what you took for your primary dose, no? So depende kung ano yung nag-umpisa ka, no? Tapos alam mo kung ano yung interval, and then may option, no? Kung yung first booster mo ay homologous or heterologous. Tas again, 3 months after the first booster, pwede po mag-second booster yung immunocompromised pa lang, no? At makita nyo dito, basically, ang daming options, no, na pwede nyong gamitin. And yun nga, nasabi nga ni Sir kanina, na advisable, no, or we recommend yung heterologous booster. So here are, it's really just a lot of combinations are possible. Please refer to this table for guidance. Depende kung ano yung nakuha mo. I think, ma'am, yun lang from my
Thank you. Ayan, mga kaibigan, paki-screenshot na po and you can study that at your own leisure. Para at least yan, kompleto na yan. So I actually have one last question, pero before, isisingit ko na rin to, no? Kasi madalas itong tanungin. This is the penultimate question. There are some countries kasi that have certain vaccine requirements, no? Certain vaccine requirements. For example, sa Japan, those who have there are certain vaccines that are acknowledged. Pero kunyari ikaw nakakuha ka ng 2 Sinovac, complete ka sa Sinovac. Tapos kailangan mo kasi ng complete dose ng isang COVID vaccine. And Sinovac is not in their recommended. It is effective, but it's not in the recommended list. So kailangan nila isang complete series na recommended vaccine ng Japan, tapos merong booster. Ang tanong, kunyari nakapag-complete series with Sinovac, and then yung booster niya is accepted, kunyari Moderna o Pfizer. What would you advise someone? Do you advise someone to just stick with that, or when a 4th booster is available, kunyari yung one of the immunocompromised, treat it as a second series. Yung kunyari na Pfizer siya, di ba? As a booster. Kompletuhin na niya yung second booster as parang consider na Pfizer pareho? Or would you just say na stick with that, nag-Sinovac complete and then one Pfizer booster is okay? And just go with, kasi sa Japan, pag ganun ang ginawa mo, you just have to undergo the 7-day mandatory quarantine. Do you advise? So the question is, kompletuhin ba niya yung second booster, yung sa Pfizer, kumuha pa siya na isang Pfizer para kunwari Pfizer yung complete series niya? Or okay na yun? Tapos mag-quarantine na lang siya? Ano po ang opinion niyo doon? So recap, complete series ng Sinovac plus 1 Pfizer booster. Is that all right? Is that all right? Or would you advise her to get a second Pfizer? Tapos treat that booster as kasi Pfizer is recommended sa Japan. So i-consider yung booster niya as the complete series niya. What do you think? Actually, this is an actual question. What would you advise? Gulo, no? This is real world issues to. Real world issues.
Hindi magulo yan. You just have to follow. You have to follow the official recommendation. When you get 2 doses of the same vaccine, that is what we call the primary series. Okay, so 2 doses. Now, whether you get the 3rd dose to be a different one or the same one, right now it is considered your 3rd dose. And you don't have to get a 2nd dose just to make it complete. Yes. Because the 3 doses that you have had is already a primary plus a booster. In fact, your example of 2 Sinovac plus Pfizer, that is exactly what I have right now. And I am confident that I am protected. And I am not very, very, very eager to get a second booster unless Beverly and the H-tag and the NITAG and the tag tells me so. And I am 72 years old.
You look so young, ma'am. Thank you, Doc Lulu, ha? So, you
selected I have a 17 and a 16-year-old granddaughter and grandson.
Amazing. Sana all, Doc Lulu. Okay, so ayan ha. Primary series. Yan, primary series ang first 2 pag na-complete nyo. So, kung kunyari, meron kang 3rd, hindi ka pwede mag-second primary series. Isa lang talaga yung primary series mo. So, again, okay na yan. Siguro awat muna. No? Sa recommendations. Okay, for the last question, and this is important. Who are legally authorized to administer vaccines, and are drugstores legally authorized to sell and administer? Pwede bang bilhin ito sa... okay. So I saw this. Someone would like to answer this question live or to ask this question live. I see it. Can you see it from the chat? Would the tech team, what is this? They would like to answer or ask the question live. Who are legally authorized to administer vaccines? Are drugstores legally authorized to sell and administer? This is the question in the Q&A. Anyway, so while waiting for that, any of our panelists, sino ba ang pwede ka ba makakuha ng vaccine sa drugstore? Pwede ba sila Yeah, Doc Bev, I see you nodding.
Yes po, no? So if it's syempre we differentiate COVID vaccine, no, has a very different implementation mechanism. Pero yung all the other vaccines, regular COVID vaccines, they can be sold and administered, no, as long as the people who are administering them are authorized. So sino yon, no? So mga doctors, syempre, pharmacists na may training, no, nurses are also allowed to provide it. Meron lang bakuna na pwede yung midwives also, no, for childhood vaccines, they're actually also giving it. But for COVID vaccines, hindi po sila pwedeng ibenta. I think yun lang yung difference kasi they all are still under emergency use authorization. So you shouldn't be buying it from any of these structures, no, mga pharmacies, etc. We do have partnerships with them for Rest Bakuna program, but ang agreement is wala po talaga silang bayad for this. Over, ma'am.
Okay, thank you. And that ends our question and answer. We have so many questions, but that's all the time we have. And before we end, I'd like to ask each of our speakers for their final word or last message to our audience. So who would like to begin? Final words lang po. Doc Melvin. Huling message mo sa ating audience. Yes.
Ang message lang is sa mga kababayan natin or sa mga nanonood na nagpabakuna na, thank you very much. Really, you are helping not just yourselves and your family, but the country, no, na matapos yung pandemic. And I hope you can convince your friends and colleagues to do the same. Kasi kayo po ang ebidensya na ang bakuna ay ligtas at epektibo. So, kung kayo po na nabakunahan na, ang mag-convince sa mga hindi pa nabakunahan na family members nyo or colleagues, mas maniniwala po sila sa inyo kasi kilala nila kayo at yung ebidensya kaysa sa amin na magsabi sa kanila, di ba? So I hope you can all do that po sa mga circle of friends and families nyo po.
Thank you, Doc Melvin. Doc Bev, your final message to our audience, and thank you for the infographics that you shared.
Thank you, ma'am. Thank you ulit sa inyong lahat na patuloy na nakikinig sa tamang mga news, no, or sa reliable sources kasi sa dami po ng nilalabas na information ngayon, sabi nga nila, everyone is a content creator. Wala po talagang nakakapag-edit, no? So gusto po namin na nagtatanong kayo. It's good to be asking questions. It's good to question. We appreciate that. But also, it comes with knowing where to find the answers to the questions, no, to the reliable sources. Kasi fake news can kill. No? People who receive fake news and have not been able to do what needs to be done, like get themselves vaccinated, they can actually die, no, from believing in fake news. So talagang kailangan lahat tayo maging responsable sa pag-share ng news. And ang kailangan natin i-share is that vaccines are safe and effective. Thank you very much.
Thank you. Vaccines are safe and effective. Well said, Doc Bev. And last but not the least, Doc Lulu Bravo for her final words and her passionate advocacy.
Thank you, Wen. And thank you very much for all the speakers. I believe that the last and the only message, if you don't have anything else, is that vaccination saves lives. It was meant to be since 230 years ago. And definitely, if they can only be there for you always to save lives. If only you will trust that people want to save lives. The history is there. It's a long history. But there are always obstructions along the way. But definitely, if we want to save lives, we will continue developing more and more, newer and newer vaccines, because the battle, the war will always be there. Diseases will always be there. And just like sa Ukraine and all those Russian armaments, imagine they're continually using weapons to fight each other. But here, we are using weapons to fight those invisible organisms that we are able to. So thank you very much. I thank you for you medical students palang tayo, but you are still considered heroes. You are part of the solution for this war that we are having against all these microorganisms. And make sure you get to involve the others, because I know for a fact that our new sorority and your community health workers, they can also be heroes, not just the health workers per se, but all of you who work together to become vaccine champions. You are the real heroes. Thank you.
Thank you, Doc Lulu, for that very inspiring message and call. Okay, so that wraps up our webinar for today. Thank you to Dr. Sanikas, Dr. Ho, and Dr. Bravo for taking time out of your busy schedules to share your thoughts and your insights and your knowledge with us today. So before finally ending today's event, let us first watch this immunity fact or myth TikTok series prepared by our very own immunity team to further appreciate the learnings from today's lecture series.
Fact or myth? Nakakamatay ang bakuna. Magandang araw po, ako si isang estudyanteng doktor at nandito ako para sagutin ang tanong na ito. Nakakamatay ang bakuna. Ito po ay isang myth. Ang mga bakuna ay inilikha para maprotektahan tayo sa iba't ibang uri ng sakit gaya na lang ng trangkaso, bulutong, COVID-19 at marami pang iba. Sa pamamagitan ng pagbabakuna, nakakaiwas tayo sa labis na pagkakasakit at binabawasan din ito ang panganib na maging talamak ang sakit sa isang komunidad. Muli po, ang bakuna ay hindi nakakamatay. Ito ay nagsisilbing shield o extra layer ng proteksyon ng ating katawan laban sa iba't ibang uri ng sakit.
Fact or myth? Mapapalitan ng iyong DNA kapag ikaw ay nagpabakuna. Magandang araw po, ako si Jessa, isang estudyanteng doktor, at nandito ako para sagutin ang tanong na ito. Mapapalitan ng iyong DNA kapag ikaw ay nagpabakuna. Ito po ay isang myth. Ang katotohanan, ang bakuna ay naglalaman ng DNA, RNA o protein material na siyang nagtuturo sa ating katawan kung paano labanan ng sakit. Ngunit, hindi nito binabago o pinapalitan ang ating genes. Hindi makakaapekto ang bakuna sa ating genetic material at mas lalong hindi nito papalitan ng ating DNA. Ang bakuna ay ligtas at mabisa. Ito po ay maling usap-usapan lamang at hindi batay sa katotohanan.
Fact or myth? Ang bakuna ay may kasamang microchip. Magandang araw po, ako po si Faye, isang estudyanteng doktor at nandito po ako para sagutin ang tanong na ito. Ang bakuna ay may kasamang microchip. Ito ay myth. Ang ating bakuna ay hindi naglalaman ng microchip o tracking device. Walang anumang uri ng aparatong pagsubaybay sa ating mga bakuna. Ang karayom na ginagamit sa pagbabakuna ay higit na mas maliit kumpara sa pinakamaliit na microchip kaya nakakasigurado na hindi ito basta't-basta maipapasok sa ating katawan. Ang listahan ng mga sangkap sa bawat bakuna ay matatagpuan online. Ang bakuna ay ligtas at mabisa. Ito po ay maling usap-usapan lamang at hindi nakabatay sa katotohanan.
Fact or myth? Hindi na ako magkakasakit pag ako ay nagpapakuna. Magandang araw po, ako si 𝐏𝐚𝐬𝐬𝐩, isang estudyanteng doktor at nandito ako para sagutin ang tanong na ito. Hindi na ako magkakasakit pag ako ay nagpapakuna. Ito ay myth. maaari pa ring mahawa ng sakit, ngunit hindi ibig sabihin na hindi mabisa ang mga bakuna. Sa makatuwid, ang bakuna ay nagsisilbing proteksyon laban sa mga malubhang karamdaman o pagkamatay. Halimbawa, kapag ikaw ay nagpabakuna para sa COVID-19, magiging ligtas ka laban sa mga malubhang sakit dulot ng COVID-19, pangangailangang maospital, at magkamatay dahil sa COVID-19. Lahat ng ito ay maaaring maiwasan. Dahil sa bakuna, ikaw ay protektado.
At laging tatandaan,
Ang bakuna ang pangunahin at pinaka-epektibong prevensyon sa iba't ibang uri ng sakit.
Balik tiwala,
Balik bakuna.
Wow, ang ganda naman. Thank you for those very informative videos. We would also like to invite everyone to participate in the third installation of Bakunadong Bayani, one of the projects, the flagship projects of immunity. It aims to provide free influenza vaccines to UP Manila students and UP Manila and PGH employees. It's happening this May, and more details will be posted soon on our social media accounts, so stay tuned. Once again, this event is brought to you by the Immunity, an ounce of prevention of the Mu Sigma Phi Medical Sorority Incorporated, under the Mu Heal campaign, the Mu Sigma Phi Foundation, in partnership with the Philippine Foundation for Vaccination, Philippine General Hospital, UP-PGH Health Service, and the Mu Sigma Phi Fraternity. We would also like to acknowledge our official social media partner, the Philippine Star, and we'd like to thank UP Information Management Team, the UP Information Management Service Team, for supporting us in our advocacy of sharing valuable knowledge as a tool in maintaining one's health and in preventing disease. This webinar and our previous webinars are uploaded on our Facebook and YouTube sites listed here. Please follow Immunitweets on Twitter for more updates. You may also follow us on our social media accounts, TikTok, at Mu Heal's Instagram, at Mu Heal's Instagram at Mu Heal's, Facebook, Mu Heal's, and YouTube, Mu Heal's. We have also installed this set of immunity booster stickers available for free on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. Please see the download links for Viber and Telegram in the video description. Additionally, we have also launched this new set of stickers, Immunity Boosters 2.0, also available for free on Viber and Telegram. We would also like to invite you to download the Immunity mobile app. It's a user-friendly and physician-guided health mobile app, which features an immunization record and tracker, an information atlas on all the vaccines available in the Philippines, and frequently answered questions and myths on vaccination. It is currently available for free at the Google Play Store. Search Immunity, Mu Sigma Phi Medical Sorority, and click Install. Thank you to our online audience who have tuned in on today's session. We hope you have learned a lot. Please stay tuned for some reminders. This is Wen Raymundo, wishing you a safe week ahead. Thank you.
Thank you for attending Immunization, a Passport to Longevity. This event is brought to you by the Immunity, an ounce of prevention of the Mu Sigma Phi Medical Sorority Incorporated, under the Mu Heal campaign and the Mu Sigma Phi Foundation, in partnership with the Philippine Foundation for Vaccination, Philippine General Hospital, UP-PGH Health Service, Association of Philippine Medical Colleges Student Network, and the Mu Sigma Phi Fraternity. We would also like to thank our official media partner, the Philippine Star. Special thanks to the UP Information Management Service team for supporting us in our advocacy of sharing valuable knowledge as a tool in maintaining one's health and in preventing disease. This webinar and our previous webinars are uploaded on our Facebook and YouTube sites listed here. Please follow Immunitweets on Twitter for more updates. You may also follow us on our social media accounts, TikTok and Instagram at �W𝐐𝐬𝐬𝐷, Facebook and YouTube �W𝐐𝐬𝐬𝐷. We have also installed this set of immunity booster stickers available for free on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. Please see the download links for Viber and Telegram in the video description. Additionally, today, we are launching this new set of stickers on getting your COVID-19 booster shots, also available for free on Viber and Telegram. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features an immunization record and tracker, an information atlas on all vaccines available in the Philippines, and frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Just search Immunity mu Sigma Phi Medical Sorority Incorporated and click Install. Once again, thank you and keep safe. At laging tandaan, ang bakuna ang pangunahin at pinaka-epektibong probensyon laban sa iba't ibang uri ng sakit. Balik tiwala, balik bakuna.
Recording stopped.